contribution that nurses make to societies around the world make them worthy health professionals that should be celebrated, more so now that they are on the front line in the battle against the coronavirus pandemic, towing the footsteps and upholding the legacy of the woman adjudged as the world's famous nurse, Florence Nightingale. On this episode of Health Options, we celebrate all the Nigerian nurses, especially those who discharge their duties with utmost professionalism, laced with compassion, love and kindness, even when the going gets tough, as it is today with the ravaging COVID-19. Thanks for joining us on Health Options for this week. I am Rabi, Abdallah. You are watching Health Options, and as we key into the World Health Assembly's declaration of 2020 as the Year of Nurses and the observance of this year's International Nurses Day in the face of COVID-19, we begin with these clips of some encouraging hand claps in appreciation of Nigerian nurses, especially those on the front line in the battle against the coronavirus pandemic.
The Ayedo wants to appreciate
the nurses,
the doctors,
the pharmacists,
and all the healthcare professionals.
And this is also from me on behalf of the Health Options team. Let's now go feel the pulse of one of those foot soldiers of Florence Nightingale out there, nursing patients out of COVID-19 amidst the moral and psychological support from fellow nurses holding forth in other areas of healthcare needs. I have joining me now via Zoom from the Cairo Isolation Center in the FCT, a brave young nurse, a young father of a 3-month-old baby, Emmanuel Egop. Nice to see you, Emmanuel.
Nice to see you, ma'am.
How are you doing?
I'm doing fine.
Okay, so how are the patients over there?
Yeah, they're doing very well. They're coping. We're allaying the anxiety. Yeah, they're doing fine.
Okay, can you share with us what a normal day for you at the isolation center with the patients is like?
Okay, so a normal day is we come in the morning, or depending on the shift you run, and then you try to assess the anxiety state of the patient, because psychological therapy is very key in managing the COVID-19 patients. And then you look out for their medications, because at the center, everybody is positive. So we look out for signs. Are they still having some of those signs? Have they taken their drugs? What about the infection prevention control? You disinfect the places and clean their rooms, ensure they have food. Basically, that's what we do.
Okay, so how has your relationship with the patient been? We've received stories about, hostility on the part of some of the patients. Are you experiencing such where you are?
Well, Cairo Center opened about 4 days ago, and we have not experienced any of such thing. But we had some complaints and agitation, just mild agitation about patients wanting to come out of their isolation center, which we have spoken to and we've addressed, and they understand the situation and the infectious rate, and we don't have any of that for now.
Okay. I learned that your wife is also a nurse. So can you tell us more about that?
Okay, my wife is a nurse. She just put to bed on the 5th of February, and she's at home. So she has been on maternity leave, She had to take an extra maternity leave because I'm not there to assist, and we don't have anybody staying with us for the moment. So yeah, we're doing well.
Okay,
She works with Gariki Hospital by.
Okay, we salute your bravery, the fact that you are a young father. That has not deterred you. That's why we're proud of you nurses, holding forth and looking after the patients out there. So kudos to you. And this is a hand clap for me on behalf of the production team here. Do you have other nurses around there with you?
Okay, yes, I have one with me. Unfortunately, when you called, we're just preparing to go into the ward to attend to the patient. So I have one of my colleagues here.
Okay.
We're actually doing the circulation and then doing the internal control. So he's the bearer.
Can we get to see him? A wave, just wave at us. Wave at us. Can you wave at us? Okay. We're proud of you guys and we're praying for you, and we pray that Almighty protect you and give you the strength to carry on.
Thank you. Thank you very much. And
So,
thank you for having me.
what safety message do you have?
Okay, it's for them to stay safe and ensure that they wear their mask, they practice good hand hygiene, you wash your hands, or you use sanitizer, alcohol-based sanitizer, so that we are also not overwhelmed in the center. Presently, we have about 8 patients, and we have a capacity of about 27. So we hope that by avoiding misinformation, because I still believe there are some people who believe that COVID-19 is not real or is made for the rich, but here at the center we have seen both middle class, lower class, and upper class, and so it can affect just anybody. So trying to stay safe, stay at home if you don't have anything doing. You must come out, wear your face mask, and keep your distance, and that would be very good, and will also make our work really easy.
All right, thank you so much for talking to us on Health Options, Emmanuel. We wish you well.
Thank you very much. It's been my pleasure, man.
All right.
Supporting our colleagues, the nurses, the midwife, who are on the front burner of fighting COVID-19 is essential. Why? Because they need all the support to ensure that they do the right thing at the right time to care for this patient. Quality nursing care, passionate nursing care, that is what we deserve and we desire for our patients. So what we do most time is to call them on phone. We speak to them as often as possible just to boost their morale, to celebrate them that, look, thank you for representing us, you are doing very well. And again, we also organize webinar symposium for them where we discuss about the right things to do in caring for our patient, because the patient with COVID-19 is not just an ordinary patient. They might take drugs, they might take anything you give them, but the psychological component of it is also vital. So patient might just not talk to you, but not knowing that they are deep down depressed, thinking of their family, thinking of their job, thinking of the stigmatization. So if nurses are available 24/7 to take care of this patient, which means that the psychological support for this patient is optimal, which means that the psychological support they give to patient outside the drugs, outside the sample, the investigation they carry out is also key. And for them not to break down, it's a continuum of care. So we also take care of them in order to give quality of care. We organize conferences for them, we make calls, we make Zoom calls so that they can see us and see us celebrating and clapping for them. And that is what results or what led to the national applaud for the nurses, where we clap for them to just celebrate them that you guys are doing wonderful. And I also want to appreciate all our leaders in the country who also have taken support of that to clap for them. That alone boost their morale, that yes, we are not just working alone, we are working on the Nigerian government, and their colleagues too appreciate them. Again, we serve as their advocate. We speak to the government, we speak to the commissioners, we speak to every level of governance in order to see that the adequate PPE is available. Because they might be there, they might not have the opportunity to speak for themselves. So we serve as their advocate and speak to the respectful organs of government in order to ensure that the PPE is available and every other thing they need to ensure that these services is being given to our patient is also available. It is just a possibility that the nurses and other healthcare professionals who are direct contact with this patient at high risk of contacting it. We all know that COVID-19 is highly infectious. So you cannot rule out the fact that the healthcare professional, particularly the nurses, who are the front burner of patient care, are at risk and they will contact it. Some of our nurses have been positive. Some of them have also lost their life in the care of patients, with COVID-19. So it's highly infectious. Again, the way people are, they will come to the facility without declaring their true identity. They won't tell you their travel history. They won't tell you their contacts. Some of them, if you go to the isolation centers now, you will realize that they don't even know, they can't even tell how they contacted it. They can't even tell the line of contact. They will tell you they don't know. And as a nurse, that is the oath we have taken. You cannot but to accept them. You cannot but to embrace them. And that is why community sensitization is key. Community sensitization is key. Let Nigerian government look at the structure from the political world level to the local government level to the state and to the federal. Let everybody, let every community, let every household be sensitized. Let them know how to prevent themselves. We are doing that to ensure that the legacy Florence Nightingale have laid continue. It live in us, where we take care of our patients without, even with nothing. That is why you could see a nurse even without being paid. Right now, some of our nurses have not been paid. They've not received their salary from January till now, but they are still working. It's just in the spirit of Florence Nightingale. It's in the spirit of sustainable development goal. It's this in the spirit of achieving universal healthcare coverage, leaving no one behind.
Joining me now in the studio for a discussion on nurses as major frontliners in the battle against COVID-19 is Registrar of the Nursing and Midwifery Council of Nigeria, Farouk Umar Abubakar. Thanks for joining us.
Thank you.
Okay. Nurses, whether male or female, are all important and critical arm of the health professionals. And this year particularly is a special one for nurses the world over. And we have your men and women back home in the country doing us wonderfully proud. I had a session with a young male nurse, Emmanuel Egap Adekaru, who is currently serving at the Cairo Isolation Center. And it's good to know that there are people who are really living the legacy of Florence Nightingale. On that note, how does it feel as the registrar of the Nursing and Midwifery Council of Nigeria, having your men and women out there making a difference?
Thank you very much for these questions. I feel so proud that nurses of this country are making positive contribution in handling the COVID patient in this country. And it is a well-known fact that nurses are frontliners in handling this. And they are putting their expertise that they have acquired during their training, and that we are proud, and they are making the difference. And that is, I feel proud, and every Nigerian is also proud with what the nurses are doing in handling the COVID-19 in this country. Okay,
what would you say remains your major fear where their safety is concerned?
Yeah, the issue of, I want to appreciate the PTF ensuring that they have provided some of the basic equipment that is required in handling this patient, more precisely the personal protective PPEs are adequately provided, and for nurses to use. Not only at the orientation center, in almost all the tertiary hospitals, they are provided, and nurses are, because they are the frontliners, and they are using it adequately, apart from the PPEs and other precautionary measures that will help to prevent the spread of this current are also implemented by nurses, knowing very well nurses have the knowledge, have the skills to carry out the infection prevention in most of the healthcare facilities.
Okay, you are entrusted with the mandate of certifying nurses and ensuring professionalism, ensuring quality assurance in their practices. In the past, stories abound about the attitude of nurses towards the patients. Can we afford to see such attitudes where the handling of COVID-19 patients are concerned?
Well, at this critical time, the interest of patient is paramount important than any other thing. And that is why today you find there is less complaint from public as far as handling the COVID patient is concerned, because the much interest is the patient's life. And that's why nurses have now, if there are such negative criticism before, as far as handling the issue of COVID-19 is concerned, nurses have put all that negative attitude and they accept patient in totality and ensure that they provide the best care and they recover and go back to their family. Okay,
you must have received at least sad notes about some who had either contracted the virus or had died in the process of nursing COVID-19 patients. How would you react to that?
Yeah, I think it's part of the calamity and that part of the hazard as a professional. But I feel sad about that, and we pray to the Almighty God to provide solution and probably forgive his differences and maybe his sin that has happened along the line, because he died at the cost of national duty, and that's what we feel. But and that's why we also emphasize that nurses should take extra care and ensure that the PPE are available while handling patient, because you cannot take chances. If you become a victim, you are also become. And I want to appreciate that government has put in a number of motivational measures that will motivate the nurses.
Can you give us an insight into the World Health Assembly's declaration of 2020 as the year of nurses?
Yeah, the World Health Declaration 2020 has now stated that the boys to lead nursing the world to health, in order to demonstrate how nurses are key or central in addressing the wide health challenges all over the world. And this is what the theme for 2020. And as it is in this country, I want to affirm that nurses are central in handling almost all the pandemic patients in almost all the centers across the country. And the nurses are there as a key, and they are there receiving patients, they are there attending to the patient, they see them 24 hours. And they provide whatever required for the patient in order to restore their health as part of their mandate. And that's why they are part of the celebration this year. The nurses feel that WHO declare 2020 as the year of nurse and midwife. They have taken it as their own spirit to ensure that the best care can be given, especially at this period of pandemic. And they are doing it all over the country.
Okay, speaking from the point of the registrar of the council, would you say we have enough nurses in the country?
Well, I want to say these are one of the
registered nurses.
The registered nurses, they are grossly inadequate. And I want to say we have active nurses in this country, just roughly about 124,000 nurses and midwives. Nurses and midwives active. That are managing all our tertiary institutions, which is grossly inadequate. Looking at the projection according to WHO, the country should have a projection about 800,000 nurses to handle our healthcare facilities in this country. Looking at 10,000 nurses, every 10,000 population should have a 40 nurse. And with this ratio we have, that we can see is grossly inadequate. As a council, we are putting all necessary measures. Like this year, as part of our celebration, as part of our mandate, we have put in measures to increase the production of nurses across the country. And that's why we have approved what is referred as two-stream training of nurses, which have been done in early 80s and 90s, and we have now instituted that measures this year, so that in the next 3 years we're able to double up the production of nurses by 100%.
Okay, so are you saying you haven't received any report from your men and women out there regarding maybe how their welfare could be improved? I'm aware of the hazard allowances that the federal government had approved for health workers, including nurses.
Yeah.
So are you saying it's all a rosy situation with the nurses?
Well, I want to say that first,
especially the frontliners.
The frontline. I want to first appreciate the government effort by approving that, and all what we are waiting to see the implementations, and we hope that within the shortest possible time it will be implemented, so that. I also want to appeal, where there are complaints from other parts of the country, some other states, should also reciprocate what the federal government does in approving the new remuneration, including the hazard and other related remuneration, in order for nurses to motivate them and do their best. And as it is, we so much appreciate the federal government effort in approving that, more especially on the part of the nurses as the frontliners, and these are part of the motivation given to them.
On a humorous note now, I've heard female nurses boasting about the fact that they make the best wives. Do male nurses equally make the best husbands?
Yeah.
You are a male nurse.
Yes, certainly, because the training is the same part, and we undergo the same training. And I want to assure you, male are also best nurses, best husbands in their own families.
Male nurses.
Male nurses are also best husbands. And you can now carry out the research, and I'm sure most of the wives that were married, they will be able to attest to that, to tell you that male nurses are also one of the best.
Just like your female nurses make good wives. Yeah,
that's what I'm saying. It's just the same.
So the caring goes beyond the hospital walls.
Exactly. Most of the husband, you find, they go ahead and more do what is even the woman should do as part of her responsibility at home as male nurses. Okay. And they also extend the same thing.
So all in the spirit of the principles
of caring.
Okay. Thank you so much, Malam Farouk Umar Abakar, for coming on Health Options.
Thank you very much.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
That does it on this week's episode of Health Options. COVID-19 is real, so take responsibility and stay safe. A quick reminder also that you can watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi, Abdallah. Thanks for watching. Bye for now.